Can you chill martinis with a cold laser?
No. So if you're thinking about getting one of these lasers, sorry folks, you cannot chill a martini.
Not for a mixologist, unless he has tennis elbow.
Yeah, exactly. Which I'm sure a lot of mixologists
I would
do.
bet, yeah.
All that shaking and stirring.
Yep.
So for anybody that suffered from tennis elbow or golfer's elbow, it could be really frustrating because we all use our hands every day on our phones. When you even use your thumbs, you're just using his thumb. You're using you can see the muscles up here moving just from using these two fingers. So these tendons run all the way up into the forearm here. So just from pinching things, you're going to be using the muscles up here in the lateral part of the elbow. So when it is inflamed, people really have a hard time working and functioning because, again, everything we do is with our hands. So don't let this get worse. You can, if you first develop it, you could certainly take something over the counter like ibuprofen for about 7 days. But if it comes back or never goes away after those 7 days, I would recommend cold laser therapy, getting the elbow checked, make sure you don't need it adjusted, and then as a last resort, cortisone.
But even still, cortisone's just to take the edge off, right?
Yeah, it's just medication. It's not going to heal and repair it. It's just going to get rid of the pain. But if you're in a lot of pain, you do what you have to do in some cases.
Sure.
Okay, don't look here. So I start away from the injury on purpose because we have the impedance meter. So we want to start on healthy tissue. Sure enough, it beeps right on the lateral aspect of his elbow.
And I'm wondering now that if I was watching this video, I'm wondering, is it developing in the left arm because I'm overcompensating for the right arm? I mean, is that typical? Or?
It might be, absolutely.
Because this one has been way worse, but this one's coming right behind.
Starting to get bad, yeah. So he started with right-sided tennis elbow. Now it's on the left side. I'm sure you're carrying the baby on both sides?
Yeah, but more on my left now to offload from this arm.
And something that most of you, just a useless fact, is that women can actually externally rotate their elbow about 20 degrees further than a man can. That's why, for anybody that's had a child, that's why your wife can carry the baby for hours on her hip. Doesn't mean it's healthy or good to do, but she can do it without a problem. Whereas you guys, 10 minutes in, you're complaining, can you hold the baby? You're putting the baby in the stroller. It's hard because, again, women have a 20-degree lateral external rotation to that elbow that men just don't have. It makes it easier for them.
Yeah, I have like no rotation. Well, I mean, a little.
Well, you're turning your arm out, so.
So where do you rotate?
I'd have to lay on your back and.
I guess long term, are there like what do you do you just strengthen everything around there? Or do you keep it flexible?
Once we reduce the inflammation, heal and repair the soft tissue in the area, we're going to give you stretches and exercises to start doing.
Okay.
And we're going to do a course of about 3 weeks of laser treatments, 3 to 4 weeks. There you go. There's some inflammation there.
Definitely feel it in there.
A sensitive spot for you.
Mm-hmm.
The beauty about this laser is it tells me areas to dose, where there's inflammation, and for how long to dose. That area we didn't need to dose that long.
Wow, that's pretty cool.
We're going to go back over it though and just double check it. Sometimes you need to dose it again.
Oh, same spot.
Okay, good. This one's dosing a little bit longer. There we go.
Okay. Now, are these glasses I can wear out at night, like in bars and stuff?
Yeah.
That's
You
cool.
can wear, well, I don't know about at night. You might look kind of funny wearing sunglasses at night. Unless you want to crank that tune in your boom box. I wear my sunglasses at night, but No, I mean, you can wear them during the day. They look like blue blockers, you know?
Yeah, I like it. That's cool.
Ray-Bans, you know?
Yeah.
Stylish. Gonna go all the way down the arm into the wrist. Now, this is not his first treatment, so some of his tendonitis is a little better, but this gives you a good idea of how we treat tennis elbow or golfer's elbow with cold laser therapy. Thanks for tuning in. We're going to follow up in a couple of treatments and track his progress. Thanks for tuning in, guys. One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you. Have you been doing a lot with your hands the last few days?
No, I'm
Did
gonna
I
try to
see
lay
you?
off it. We did a quick session yesterday, and then a longer one on Tuesday. But no, I mean that's what's so frustrating about this injury is you lay off it and then it's
Flares back up.
Yeah.
How many times or how? When was your first episode of tennis elbow? Like, you know,
Probably
do you
about
remember
a year ago.
A year ago?
Yeah, probably
Do
about
you
a year
remember
ago.
ever getting it when you were younger? Or
No, definitely not.
Definitely not. So this was your first time about a year ago?
Yeah.
Has it been consistent for the year, or has it been sort of on and off?
On and off, but the last time it flared in like February, March, like during March, it flared up to the point where all the muscles were throbbing and I couldn't sleep at night. I mean, it was extremely painful.
And that's when you went and got the injection?
Yeah.
Okay, so we're running it across here. Let's see, we might find another spotter or two here. Okay. Yeah, so more laser is not necessarily better, right? So we certainly don't want to oversaturate you. That's the worst thing we can do. We'd rather undersaturate than oversaturate.
Okay. And I'm also the type that's like really diligent when I was feeling better about stretching it all the time, trying to be careful lifting things.
You can stretch it. I just wouldn't use a lacrosse ball. That's more of a deep tissue, like trigger point therapy. I would stretch it. Stretching, you know, like that's fine.
Both of those, yeah.
But the ball may, it may aggravate things.
Yeah, I've laid off that for a while.
Are you ambidextrous?
No. But I've certainly offloaded to my left hand, to my left arm a lot in the last several months, you know.
Mm-hmm.
Now it's frustratingly
What,
developing.
just carrying the baby, you mean?
Well, picking up pots, taking out garbage, carrying a kid, yeah.
So you never carried out garbage before?
I did, but I guess
I think the new thing is the baby. I think holding and carrying the baby is probably, although that didn't, the baby's only a couple months old, not
He's
a
only
year.
6 weeks, yeah. So this was really a March and April problem until I got the shot for
What
September.
changed a year ago?
I don't know. I will tell you though, and I don't know if this is common. I was picking up a heavy pot of water with my right hand cooking, and I picked it up from the stove to bring it, you know, right in that motion to bring it over, and I felt the tendon go, and I was afraid I tore something, and that's when I first went to the doctor, and he said it's tennis elbow. Your muscles, everything was so tight in here.
You feel it was just lifting that heavy pot?
Well, that was like the straw that broke, you know, the camelback. But
was that the first time you ever cooked a meal, or?
No. I've been cooking for years, but I'll cook. Wife doesn't cook in my house.
I'm just kidding. She doesn't cook?
No.
Okay.
Luckily, she takes care of the baby a lot, so I do the cooking
See, I have a
and the
deal.
trash.
I have a deal with mine that if I cook, she'll clean. If she cooks, I clean.
Yeah, we do.
I'm not a big fan of the cleaning up afterwards, especially if I cooked.
I'm a clean while I go in between steps guy. So.
You are.
So I get about 75% of it done.
I try to keep it clean while I'm cooking, kind of deal, you know.
Yeah, that's what I
Not to
mean.
make a mess.
Yeah.
However, my girlfriend, she's like a hurricane.
Yes, I call my
She
wife
comes in
Tasmanian.
and I come out and she'll make like a salad and there would be like pots and pans. I'm like, what do you need? What are pots and pans? You know, I don't know how she does it, but it's like a hurricane in there. So I always have to clean up. I'd rather cook and
Right. I call my wife Tasmanian Devil. Same deal.
Tasmanian Devil, yeah.
You right? She's like, I'm gonna make chicken. There's 14 pots. There's a colander for no reason. Yeah.
And you and me, there's like 2 pots,
Right.
one for the pasta and one for the chicken.
Right.
And if we can fit it into one,
Right.
we'll do it.
Right. One skillet meals. That's the way to go.
Yeah. All right, folks. Okay, there. It just finished dosing. We're gonna run it right up the arm here.
Yeah, this one's bothering me for sure.
Thanks for watching. Thanks for tubing in, and we'll see you soon.